In today's Your Healthy Family, how many stories about how to not gain weight during our stay-at-home orders have you heard? I've heard many, and if you're like me, simply hearing them isn't helping.
If putting a food plan in front of somebody or reading an email worked, we would all be in perfect condition and have six packs.
Dr. Kristen Kells, like so many, is fighting the effects of the pandemic on many levels. Personally, as a wife and a mother, and as a small business owner.
We just scrambled around the clock, literally overnight, to transition everybody to their homes so that we can still be fully functional, to work with new clients, to work with our existing clients, but to keep them employed. They're my family. And like a lot of small business owners in this country right now, working very hard to keep employees getting an income, supporting their families. I have single moms that work for me. And so my husband and I decided that we will sacrifice everything we can to keep them employed. And I know there's so many people out there dealing with the same issues from an economic standpoint. But this is a city built on small business. I think Colorado Springs is resilient. We're going to get through this. We really will. It's just might not be pretty for a little bit.
Her employees and business are partnering with their clients and coaching them to a healthier way of life.
I have a full team right now that I'm so blessed that we can keep everybody employed and working and helping our clients, but they're answering texts, phone calls, follow-ups with clients, virtual meetings. We've been able to do everything virtually.
And let's face it, life has become more challenging for many right now.
I, first of all, want to just acknowledge and recognize, man, there's grieving. I've never seen anything like this, nor has anybody alive. And it's hard. There's so much going on, and eating is one of the things that is a big challenge for a lot of just being healthy.
Dr. Kell says there's a science behind why some people are so susceptible to eating their emotions.
With emotional eating, most people don't realize that in our gut, we have more serotonin receptors. So serotonin is that feel-good hormone that, antidepressants target serotonin. It's the piece of our brain that tells us happy thoughts. So when we crave food, there's a reason for it, is that our gut has its entire own nervous system called the enteric nervous system, and it has serotonin receptors more dense and more populated than our brain. So there is a reason that we stress eat.
This unique time presents unique challenges and unique opportunities.
It's such a mental game, and the social isolation. So we have factors that are the worst for our health, but the best for our health. We're protecting ourselves from a virus, but mentally it's a big challenge. And so the biggest deal, I believe, is isolation.
This is an important time to think about losing weight because looking forward, a healthier body may be the key to avoiding the worst that COVID-19 can bring on.
The mental piece of it is, I believe, focusing on what we can control versus what we can't. Our immune system is directly related to things like obesity. We know that the mortality factors for COVID and other illnesses are things like obesity, heart disease, lung problems, diabetes. And so the things we can control are our health. As challenging as it is, if we focus on what we can control, then we're in much better shape mentally and emotionally.
And during this time of social distancing and isolation, perhaps partnering with a coach in your efforts can be the key to you reaching your goals.
It's the working with somebody so they don't feel they're so alone. And then working with our mindset of, so many opportunities have been taken from us because I'm obviously shooting this from my home like everybody else, working at home with 3 adult children, a husband, 2 dogs, and a cat. Just wanting you to know that I'm in quarantine like most everybody else watching. But I'm looking at what are the opportunities afforded and working with our patients. Many of the clients are saying, I'm using this as an opportunity because think about it. All the excuses we had before are time, working, not getting out, just whatever it is, though a lot of those have gone away. We do have time to focus on ourselves. And I actually think that's why we're getting such great results, is people have the time to focus on self-care. And if I could say anything to anybody, I would say use this as a health time, a time to rest, a time to heal, a time to set new structure and new routines around your health.
So while we wait for treatments and a vaccine for coronavirus, you don't have to wait to make the changes to come out of this very abnormal time with a new normal for healthier living.
When people start our program, we say to them, this is not about us dictating something. This is about us working in partnership with you to empower you. Because it's not, a lot of people can do quick, fast weight loss and get skinny, but it's about being healthy. I care more about when I hear a grandma say, I was able to get on the floor and play with my grandson for the first time in 5 years. A woman called the other day and said, my son looked at me and said, hey, Mom, you haven't done that in years. That's more what I care about, is the whole health.
Yeah.
And all of us getting through this better people.
Yeah.
I believe that, I think if we allow this to change us in the positive ways, use it for time for healing, self-care, self-improvement, focusing on our health and our families and our relationships, on nature, will be a better, kinder world. That's my hope. That's what gets us all through this, is what does it look like on the other end, that we can use this time to help ourselves and other people.
For more on this story, including how Dr. Kells is working with her clients and new clients so that our current economic challenges don't stand in the way of getting help, head to yourhealthyfamily.com. For Your Healthy Family, I'm Ira Cronin.